Starting with introduction. What is medical laboratory? Medical or clinical laboratory? It is a laboratory where the different pathological tests are conducted on the different clinical samples, that is the patient samples, in order to obtain the information about the health conditions of a particular patient, obviously for some kind of diagnosis and prognosis. And what are the main objectives of a person who is working in such a laboratory? It includes performing the various tests, which helps in detecting again the different health conditions like cancer, diabetes, renal problems, the various infectious diseases, STDs as in the sexually transmitted diseases, which are also known as the venereal diseases, etc., etc. Next, coming to the different departments under which come under this medical laboratory, and they include majorly 5 departments: blood bank, hematology, microbiology, biochemistry, and histology. Moving on to the importance of a medical laboratory. What are the importance? Number one, it's to maintain or to improve the quality of lab work or testing. Secondly, the efficiency, and thirdly, the cost effectiveness, which is again very important, particularly in a developing country like India. And also the planning and management of the district health care. Now moving on to a very important aspect, that is the ethical issues. Ethical issues related to each and every field of medical science is very much important. Now what do you mean by ethics? It's the characters, the custom, the principles of proper human conduct, and it can also be referred to as moral. According to Webster's dictionary, it's stating that ethics is a concept which deals with the different moral issues of good and bad based on the different social norms. And it's the code, written or unwritten, which actually guides the behavior of human beings. Moving on to, so ethics may be divided into different categories. Firstly, pre-examination, then examination, and then post-examination. So for pre-examination, what is the most important ethics that we need to keep in mind is informed consent. What do you mean by informed consent? That whatever procedure you are doing on the patient, it must be informed to the patient. The patient should be aware of the different the protocols or the procedures which you are going to practice on the patient. And it's particularly important for the various invasive or risky procedures or protocols, okay, which may involve some kind of harm or some kind of risk factor to the patient. So in case of diseases which are very much complicated, like the different genetic diseases or HIV, the different infectious diseases, very much adequate counseling is required prior to collecting the sample. And also, if the sample received is unacceptable for testing, then it should be discarded, and again the same procedure needs to be conducted on the patient. And next, moving on to what are the important ethical issues in examination. So in that case also, the examination should always be performed by a skilled personnel only, okay, and it should be, the standard protocol should be followed as it's stated over here, for collection, transport, testing, reporting, etc. And there should be no fabrication of results. That is also very important. And the external and internal QC, as in the quality control, is playing a very important role in this matter, okay. Moving on to ethics in post-examination, again the same thing. It should be verified. It should be done by a an expert professional, and any kind of delay in reporting should be avoided. The confidentiality of the report should be maintained, as in what is the the result, negative or positive, whatever. Now moving on to the various safety issues. So after the ethical issues, the safety issues are also very much important. So whenever we are talking about safety issues in the lab, the most important part that we need to understand are the various good laboratory practices. Okay, so over here I have given a diagram also which states briefly about the different clinical lab practices which are very much important, and also coming to the principles is obviously implementing clear organization structures to help the scientists obtain the results in a, what to say now, reliable and auditable environment. And also the important part is the standardization of the various